Hello everyone, welcome to this short session on FRCR to be cheat codes what worked for me. With the next FRCR to be exam coming up very soon, I thought it would be helpful to share a few practical insights and last minute strategies based on my own experience. This is not meant to be a full preparation guide, but rather a quick and focused revision of the exam structure, expectations, and some practical tips that can help you perform better on the day of the exam. I'm Dr. Soham Rasar, DNB, MICR, FRCR, and I have Level 1 SCMR certification in cardiac MRI. In this session, I will quickly go through the structure of the exam, the marking scheme, passing mark trends, my personal approach to the exam, and finally the resources that helped me prepare. Let's start with the overall structure of the 2B exam. The exam has 3 components. First, short cases, where you will interpret 25 radiographs in 120 minutes. Second, long cases, where you get 6 cases to report in 75 minutes. And finally, the Viva examination, which consists of 2 sessions of 30 minutes each, where you will be reporting 6 cases. So overall, the exam is designed to test your image interpretation, clinical reasoning, and communication skills. Now let's look at the marking scheme. Short cases carry 125 marks in total with 5 marks per radiograph. Long cases contribute to 30 marks, again 5 marks per case. The biggest component is Viva, which contributes 480 marks. In the Viva, you are assessed in 2 domains, clinical domain and communication domain. The clinical domain includes observation, reasoning, safety, and knowledge, and the communication domain, which assesses how clearly and safely you communicate your findings. Looking at the recent passing mark trends, for short cases, the cutoff range is around 64 to 71.5 out of 125. For long cases, it is 16 to 18.5 out of 30. For Vivas, it's around 279 to 281 out of 480. That means the safe zone for passing short cases is 75, that is 3 marks per case. For long cases, it's around more than 20 marks, that is around 3.5 marks per case. And for long cases, it's more than 300, that is around 25 marks per case. Also remember that grace marks may be sometimes be applied if 2 components are cleared comfortably. Most short cases are chest and musculoskeletal radiograph. Typically, you will see around 11 to 13 chest x-rays and 11 to 12 MSK radiographs. There is usually 1 abdominal radiograph. Among these, the 6 to 7 cases are pediatric cases. And since you have 120 minutes for 25 radiographs, you will roughly get 4 minutes per case. The realistic target here is around 75 marks. A simple structure works best. Start with the observation, then give the most likely diagnosis and differentials, and finally mention the appropriate management and next steps. Keeping this structure helps you stay organized and efficient during the exam. A few practical tips. The biggest limiting factor here is typing speed. So start typing immediately once the exam begins. Focus mainly on the important positive findings. The less important findings, incidental findings, can be skipped if you are short on time. Always mention the comparison with previous imaging in the management section. And if there is a critical finding, clearly mention that it should be communicated immediately to the referring clinician. You can bold that finding or underline it. Also pay special attention to the lines, tubes, emergencies, and common fractures, as these are frequently asked. Now coming to the long cases, you will get 6 cases in 75 minutes, which gives roughly 10 minutes per case. A good target here would be around 20 marks out of 30 marks. The answer structure for the long cases are observation, pertinent negatives, interpretation, principal diagnosis and differential diagnosis, and management. One helpful strategy is quickly go through all cases in first 5 minutes. Identify 2 or 3 cases you are comfortable with and start with them. Focus on relevant findings rather than writing excessively long descriptions. And if time becomes tight, write the diagnosis, differentials, and management first, then go back and complete the observations. Try finishing each case in 8 minutes so that you will have more time for the cases you find difficult to answer to. Let's talk about the Viva examination. There are 2 stations with 6 cases each. Each session lasts for 30 minutes, so you get approximately 5 minutes per case. To be on a safer side, target overall score should be more than 300 marks. When you receive a case, usually you will be given a short clinical history. First, scroll through the entire image stack before commenting. Tell the examiners what you are doing. Tell them that I will first go through all the imaging stack before commenting. Then, if you identify a critical or emergency finding, mention that first and state that you would pick up your phone call and inform immediately this finding to the referring physician and concerned specialist. After that, discuss the other relevant findings. Always check whether your findings correlate with the clinical history. And finally, give one principal diagnosis and up to 3 differentials. Don't go scattergun approach like you are giving multiple differentials and you are going nowhere in the Viva. A few key tips for the Viva. Try to finish each case within 5 minutes. Listen carefully to the examiners because they are there to guide you towards the answer. It's also their duty to finish your case in 5 minutes so that they can examine you for all the cases and all the systems. Don't remain silent in the exam. Whatever you are thinking, think loudly. If you are looking at the liver, tell them that I am looking at the liver, I am looking for some lesion, etc. Because examiners, they cannot see your thought process, and then you lose marks if you stay silent. Do not get stuck in the exam. If you are not finding anything in the scan, just tell the examination that I am not finding anything significant and ask for the further relevant examination. The examiner is most likely have that examination and then you will start speaking. Most of the Indian candidates, they just get stuck up and then they lose marks. Don't get into that trap. When you are seeing the scan, when you are examining the scan in the exam, use checklist approach. Speak loudly what you are searching for and what are your checklist in that particular scan. The examiner will also give marks for that. And always conclude your case clearly. Time is money in the FRCR exam. The examiners are looking for a safe radiologist who can independently and safely report emergency scan at night time. They are not looking at the extremely talented radiologist for this examination. And approach this Viva like you are discussing any case with other department faculty in your department. Practicing with the Viva partner helps immensely. There are 3 golden keys in the FRCR exam. Always ask for the previous imaging. Identify and communicate critical findings immediately. And suggest appropriate MDT referral for each case. Finally, the resources that helped me. For short cases, reading the departmental x-rays, reporting the departmental x-rays have immense values. Radbyte's practice subscription along with the emergency radiology survival guide and chest x-ray survival guide books helped me a lot. For long cases, I used FRCR long subscription. And for Viva's radiology master's cases, along with the weekly Dr. Khan teaching sessions and Dr. Sandeep Awal sir's weekly sessions, they are really helpful. But most importantly, daily Viva practice with study partner makes a huge difference. Remember, the FRCR 2B exam is not about knowing everything. It's about demonstrating that you are a safe radiologist who can analyze images, identify critical findings, and communicate them appropriately. Trust your training and manage your time well, and stay calm during the exam. So these were the FRCR 2B cheat codes that worked for me. If this session helped you, feel free to share it with your colleagues who are preparing for the exam. And I wish all of you calm minds, sharp eyes, and confident reporting on the day of the exam. May the force be with you all.